Dr. Whiting here, and I want to talk to you about something that affects a lot of us, and that's nail fungus. Primarily, it usually occurs on toenails, but it can occur on fingernails as well. Now, the reason why it is more prevalent on toenails is because we keep our feet, for the most part, confined in warm, damp shoes and socks, and that is the ideal environment for a nail fungus. Although I've seen people with compromised immune systems also develop fingernail fungus. So what is this fungus and where does it come from? Well, there are many different strains of fungus within the human body. The primary one is the Candida albicans, which is a fungus that occurs naturally within the human body. And normally, if everything is even and equal, it doesn't cause a problem. Because the Candida organism, which resides in your intestines, is kept in balance by beneficial bacteria, or what we call probiotics. Unfortunately, many millions of people have a deficiency of beneficial bacteria due to poor diet and a whole variety of other things, excess stress, lifestyle, and so on and so on. And when the beneficial bacteria declines to a significant amount, it allows the Candida organism to explosively multiply. When this occurs, localized yeast infections such as vaginal yeast infections, jock itch in men, sinusitis begin to develop. Well, one of the potential side effects is nail fungus. And that's because the organism is now becoming slowly systemic, and it gets underneath the fingernails or the toenails, and it is very difficult sometimes to eliminate. From the medical point of view, antifungals are often used, poisoning the entire body to get rid of a toenail fungus. There are ways of helping to eliminate this problem. We have developed a two-phase program that works really well. First of all, we increase the oxygen level of your blood and soft tissue with an oral buffered oxygen supplement. By doing so, we can greatly impede and destroy the Candida albicans organism systemically because it is primarily anaerobic in nature. And when we increase the oxygen level, guess what? It overpowers its metabolism and it dies. So the first thing we do is we systemically increase the oxygen level of the body. Secondly, we use a 3% hydrogen peroxide solution. That's the kind that you can get in any drugstore. And we soak the feet, the toes that are affected with the fungus, in this solution of hydrogen peroxide for 20 minutes every other day. And between the two, often the stubborn nail fungus ends up disappearing in a matter of a couple of weeks. It just simply grows out and disappears. So there's all kinds of potential manifestations that can come about from excess yeast overgrowth. How do you know if this is the problem? Well, if you have a nail fungus, I can almost guarantee you that you have, to some extent, a systemic yeast overgrowth. However, if we want to be a bit more certain, you can go and take our Candida evaluation. It's free, it's easy, it's based on symptoms. It's based on clusters of symptoms. The greater the cluster, the more likely you have a systemic overgrowth. You can take that evaluation at thecandidaclinic.com. Once completed, we will contact you, discuss your results, and we will have a discussion as to the best approach to eliminate your systemic or localized yeast issues based on your results. Should you have any questions about this, you can reach my office at 888-454-8464. Nail fungus is something that people often live with for years, afraid to take their shoes and socks off for fear of embarrassment, etc. This need not be the problem, and there is a safe and natural alternative in most cases. You don't need to use powerful drugs to poison the entire body to get rid of a toenail fungus. There are better, safer, and more effective ways to do that. This is Dr. Whiting. Take care, stay safe, and here's to your good health.